Have you ever fallen down before? If you have, you're not alone. Hi there, my name is Elizabeth Phelan. I'm a geriatric medicine physician. I work at Harborview and I direct the fall prevention clinic. I'm here to talk with you today about fall prevention. After watching this video, you should be able to 1. Identify what constitutes a fall, 2. Get up safely from a fall, and 3. Describe 4 key fall prevention strategies. Having conversations about falls is vital. As you or a loved one ages, falling becomes more serious. It can lead to comorbidities affecting your quality of life and your independence. Your physician is ready to help. Be honest with them about any chronic pain, any balance concerns, or recent falls that you've experienced. A fall is defined as an accidental slip, trip, or stumble from a surface onto the ground or another lower surface. True or false? Does tripping on a rug count as a fall? Yes, in fact it does. If you do fall, try to land on your backside or your bottom. To get up from a fall, experts recommend not rushing to get up, taking time to assess for any injuries such as bleeding or pain, and trying to roll onto your side and using your hands to push yourself up into a seated position. Finally, crawl to a sturdy piece of furniture and use it to slowly stand upright. And don't be afraid to call 911 or see your doctor if you think you need to. 911 services are always available for you 24/7. If you need translation services, state your language of choice at the start of a call, and an interpreter will be provided to you. If you live alone, you may consider getting a personal alert device to aid in calling 911. If you see someone fall and they are unable to get up by themselves, call 911. Though it's good to know what to do in the case of a fall, it's really important to know that falls are preventable. They are not a normal part of aging. Falling can be scary, but there are many ways to prevent it. Let's discuss those strategies next. Fall prevention is important for everyone, but especially if you or a loved one is at an increased risk of falling due to age or other health condition. Fall risk is unique. That means that everyone should consult with their doctors about their own individual risk factors. There are 4 key prevention strategies that anyone who is at risk for falling ought to consider. These are: number 1, exercise. Number 2, home safety modifications. Number 3, having and maintaining good vision. And 4, attending to medications. The first strategy is exercise. Exercise can strengthen your body and help with balance and control, reducing your risk of falls. Focus on engaging in activities that help maintain or improve your strength and balance. You can even try out exercising with a friend or a loved one. While it's important to engage in exercises such as walking, it's also important to incorporate balance and strength exercises into your daily routine. Evidence-based practices such as Tai Chi are great to engage your muscles and improve your balance. The second strategy is home modifications. Modifying parts of your home to be able to support you in your daily activities can help reduce your risk of falling and help maintain your independence. In that regard, experts encourage you to have adequate lighting in your home, secure rugs and other loose items, install securely grab bars in high fall risk areas such as bathrooms, bedrooms, kitchen, and halls or stairways. Eliminate clutter to clear a pathway for you to walk safely and comfortably in your home. Use assistive devices like cane and walker if needed, as these are tools to help maintain your independence. And lastly, to call your local public health agency or local area agency on aging to get connected with home modification resources. The next recommendation is ensuring your vision is good and that any glasses prescriptions are up to date and accurate. Experts also want to make sure that you don't wear bifocals or progressive lenses while walking, that you keep your prescriptions up to date, and that you see your eye doctor at least once a year, and if you notice any changes in your vision between appointments. Finally, it's recommended to talk to your doctor about your medications. Research notes that there may be an increased risk of falling due to the side effects of certain medications and in relation to the number of medications a person takes. If you are taking more than 4 medications, you may be at increased risk of falling. Talk to your doctor about concerns with your medications. This is a great step toward preventing falls. Unsure of where to start? Here are some things to talk about with your doctor. Loss or lack of balance or strength, such as leaning on furniture when walking or trouble getting up from sitting. How to incorporate fall prevention exercises into your daily routine. And review medications. We've just outlined 4 key fall prevention strategies. Choose the option that correctly identifies those key strategies. Option 1, vision, television watching, home modifications and medications, or option 2, vision, medications, home modifications, and exercise. If you chose option 2, you are correct. Here is a summary of the key points in this video. Falls are defined as a slip, trip, or stumble that results in landing on the ground or lower level. 2, falls are not the normal part of aging. However, they can be prevented to retain your independence. The 4 key prevention steps are: number 1, exercise; number 2, home safety improvements; number 3, maintaining good vision; and number 4, attending to your medications. 4, do not be afraid to reach out for help. Your loved ones, physicians, and emergency services are all here to help you. And lastly, your community cares about your safety. Contact your local community or senior center for information on evidence-based fall prevention programs near you. Thank you for watching. This video has been brought to you by the University of Washington School of Public Health and the King County Emergency Medical Services.